Unshelling Medicine Podcast. Healthcare in the language we understand.
Hello, welcome everybody. Today I have the pleasure of being here with Jill from the Journey Sage. Hi, Jill.
Hi, good afternoon. Thank you for having me. I'm thrilled to be here.
Me too. I'm so happy to have you here. So today's topic is a topic that I'm excited to have this conversation because it is a real thing, is a problem in our society, and it's something that needs attention. So that's why I'm excited to have it. However, it is sad that we do experience it, and it is sad that sometimes it occurs in life. So today, Jill, can you tell our audience what we're talking about?
Well, we are talking about the psychedelic MDMA to heal PTSD, which unfortunately in August of 2024, the FDA delayed approval, asking for one more clinical trial. And so that's why we're continuing to have this conversation so that people understand what this particular healing modality is from my patient perspective as someone who went through the therapy.
Wow. So you're practically talking out of experience today. It's not just something you read about or something you saw on TV.
No, this is lived experience through the beginning of the pandemic. 2020 through 2021, I went through MDMA therapy for PTSD underground. I was not part of a clinical trial. And because of the tremendous results and my privilege, to be candid, of kind of falling into this therapy, I thought it was important to share what it is to help. You know, we have such a stigma around psychedelics. I had such a stigma around psychedelics. And this is a healing modality that can work for a lot of people. And it would just be really selfish on my end if I went through the treatment and didn't talk about it so that it could help other people in the future.
Absolutely. So for everybody listening, I know we've mentioned key terms that is not something that is generally used in everyday conversation. So if somebody should ask, what is PTSD? What is that?
Post-traumatic stress disorder, PTSD, most commonly heard about for veterans.
Right.
Appropriately. You go to battle, you have these horrendous experiences, you come back and you are traumatized and you are acting out in certain ways, hypervigilant and suicidal. We lose, on average, the statistics are 10 to 20-ish veterans a day to suicide. So this is an issue. For me, my PTSD, oddly enough, came from unresolved childhood trauma that I didn't even know I had to resolve until my late 40s after my partner passed. It's traditionally identifiable by an extreme sense of hypervigilance, a lack of feeling you have any control over your life, and suicidal tendencies.
Okay. So in a sense of somebody recognizing it in their loved ones, because you and I just had this conversation before we got on the call, is it important that action and intervention be sought if any of these signs that you mentioned is observed in a loved one, or if a person observes themselves performing any of this activity, hypervigilance, being one of them? Is it important to seek help? Because we tend to play down things that we don't see or things that we feel are episodal. So, or episodic in nature, I should say. So what would you say to that? Should somebody seek help, or should you seek help for a loved one?
Well, so let's be super candid about what the available help is.
Okay.
So if you or a loved one are experiencing a sense of hypervigilance, a sense of suicidality, a sense of lack of control that is preventing you from living your life, because there are people who live with PTSD. There's like long-term PTSD. For me, it was getting to the point where I was actively thinking about suicide. It was greatly impacting my life. In that instance, I did seek therapy. I went to my long-term therapist who had helped me with my grief work after I lost my husband or partner. I say husband and partner because people are like, partner, what is that? Like, we were together for over 20 years, but we never actually physically tied the knot. So after losing him, that's when this PTSD episode took over. Hypervigilance, my body was stressed, I wasn't sleeping, the suicidality. I didn't have much of a choice. I needed to go do something. In my instance, it was working with my long-term therapist who, again, had helped me with the grief, and then eventually the MDMA therapy. Most people right now, what they're finding in terms of treatment options are talk therapy and antidepressants. And I think what we're seeing, in my personal opinion, what we're seeing with the statistics, with the amount of veterans who are committing suicide daily, that the current interventions are not strong enough. So absolutely, if you're in a crisis mode, go get into therapy, go get an antidepressant, at least stabilize yourself, and then continue to look for different options, MDMA being one of them.
Okay.
One of them. There are other medicines and things of that sort.
Okay. So those, we talked about a category of people who identify that they do need help. What would you say to, say, somebody in denial, right? Somebody observing a family member who's going through, say, a crisis where their livelihood is being interrupted because of, this feeling of dread, right? But there's a belief that just either pray it away, find a hobby, distract yourself, go for a long walk. What would you say to?
Okay. Yeah. So that is a beautiful, beautiful way of describing, I think, the way most people would handle it.
Right,
Most people without a background in mental health would just say, walk it off. Come on. Everything's temporary. You'll get through this. And I think it's really important to have an understanding of trauma, which leads to PTSD. There's a book called Our Body Keeps the Score
mm,
by Vanderkolt. And what he talks about, I actually didn't believe that I had PTSD. I was a Microsoft corporate girl. I was like, have you met me? I don't have PTSD. What are you talking about? I literally gave that kind of attitude, like a roll. I couldn't have rolled my eyes even further, right? And my therapist basically said, hey, I've got a book for you. This is your homework. Go read this book, The Body Keeps the Score. And what I learned in that book, which has transformed my view of mental health, is that when we have some sort of traumatic incident in our lives, if it is not resolved at the time, so that's kind of explains why some people feel trauma off of certain situations and some people don't. If you aren't able to process those emotions in a healthy way at the time, our bodies remember that trauma, and that unresolved trauma is really the better way to say it.
right,
So that when we are in our PTSD episodes, they always go back to a prior trauma. So walking it off, hey, you'll be better tomorrow, that doesn't actually deal with the underlying trauma.
right,
The therapy I went through was not a antidepressant dampening down of symptoms. It was we're going to have a superhighway into your subconscious, and we're going to do some reparenting. We're going to understand some of why you're constantly afraid. It was because my father used to beat me when I was a child. We're going to start healing those trauma wounds the way they should have been healed if I had had responsible, emotionally available people around me when I was a child. So that was a long answer to try to break the stigma that if somebody is in a mental health crisis, they can't just really walk it off.
right. So thank you for saying that. And also, this notion of denying somebody's trauma. So you mentioned something about your childhood growing up.
Mhm.
A lot of us, unfortunately, have experienced trauma, childhood trauma. It can be anything. It can be parenting. It can be experiences, bullying in school, or molestation, right? So when it comes to quantifying trauma, from what I'm hearing you say, is important to recognize that trauma is very subjective and very individualized. So just because we are the same age and we experience the same thing, but you addressed it in a certain way and you moved past it, but I was afraid to address it. Unfortunately, I'm growing up building an adult life. It doesn't mean that I've gotten over it. It's just that I have found a way to guard that wound
Yes.
while growing up. And what would you say to adults or family members, friends, whoever in a person's life who's experiencing trauma? Should they acknowledge the trauma or deny it? And what would acknowledging and denying that trauma do for the person who's currently experiencing it?
So I'm not sure if when we're in a traumatic moment, many of us can actually say, I'm experiencing trauma right now.
Okay.
It might be more along, you know what, I'll use my example of when my partner passed. It happened to be summertime. All of my friends were out traveling. I don't really have family because I stepped away from my family because, there was no protection there. So I kind of stepped away. So I was alone
Mm.
that night and the day after, a good portion of the day after. I did not realize that aloneness was part of the trauma. If that one, there is a reason why when there's grief and someone passes, that everybody goes to the house. You bring the casserole. It's because casserole. Do they still bring that anymore? It's because when people are going through emotionally tough situations, empathetic witnesses, people to not absorb, but to listen, to comfort. That process is what helps us not retain the trauma because we're able to work out the emotions efficiently. Me, with that particular grief experience, I didn't even know I had trauma from it. Obviously, I was grieving. 6 years later, a completely different situation pops up, and I'm in this emotional flashback of that day after he passed. And I realized, oh my gosh, I've never actually processed the deep shock.
Right.
And so what did I do? I actually called a friend, took some MDMA, sat for 6 hours, and processed that grief. So again, a long answer in that we don't even, it's one reason why something is traumatic to one person and something isn't, what kind of support you have and your track record of having support throughout your life. Some people are more sensitive because they haven't had the support.
Mhm.
And then secondly, the need for connection with other people to kind of, I'm going to use the word to mitigate, to just kind of mitigate, be an empathetic witness to the emotions so that the individual can process them at the time. I'm not 1,000% sure I answered your question.
You did answer my question. You answered my question when the trauma has occurred, showing up for somebody. So, on the other side of things, how about showing up for the person on the PTSD side of things, where this occurred years, decades ago? This is where I'm sitting right now, just like you said. You called somebody and it's like, okay, I need to upload, right? So, how important is it to support a person when they're offloading, when that PTSD reoccurring state where it's like, okay, this is hitting me like a ton of bricks? How important is supporting the person? And, I would say, what are the pros and cons between supporting or basically, like we talked about earlier, telling the person to, toughen up. It's okay. That was something that happened years ago. You can move past it without proper, without proper solutions in the way of, yes, I know this was traumatic. I'm sorry this happened to you. And gosh, that's awful. Let's get you help. As opposed to, you know what, here's the Bible. Not to say the Bible doesn't help. You know, let's pray this one away, or you pray it away, or how important is that support? Because before you answer it, the reason that I'm asking is that
Yeah, I'm curious why you're
yeah.
you're focusing on this. Yeah, where's this question coming from?
Talking about personal experiences, right? The reason that I'm asking this question is that I have had both sides of that coin, right?
Okay.
And people on either end believe they did their very best to support,
Okay.
right? So one is more injurious than the other. So I come to you and at a time where I feel the most vulnerable. It doesn't feel good to revisit that place because it's painful. And then you tell me, um, don't think of it, think nothing. I mean, it happened. What can you do? Just move on. It's okay. Don't even think about it. I mean, that was years ago, right? And then the other end is like, I'm so sorry you experienced this. This is awful. This is awful. What can I do to help? Okay, so these are resources that I have. I don't think this is enough, but you know what? I'm going to work to get you more. You know, even if the person giving that listening ear did not physically support, they offered help. So for me, it was talking about comfort. It was comforting to that wound as opposed to pouring acid on that wound. So it's like one person squeezed a very nice juicy lemon on it. The other person kind of like, wiped it and covered it with gauze. Right. So that is for me, that is how that is. I know maybe some people prefer the tough love. I don't know. But when it comes to PTSD, understanding and empathy is very important. Even if you do not experience or know what it means to experience that level of pain, hearing, just listening. Sometimes it's not necessary to give advice or solution. Just listening sometimes is enough. So that's why I was asking that question. So I don't know if you've experienced it in that way where, when you came to a position of impasse and you're like, okay, I have to release, I have to let go. I need support, right? And going to somebody who listens as opposed to, being told to walk it off. You think do they equally play the same role, or what is preferred over the other for somebody actively
Oh,
experiencing something?
okay, that's what we're getting to. Okay,
Yeah.
so the question is, which is the better approach?
Right.
Saying, hey, walk it off, or somebody saying, okay, I'm going to be an empathetic listener and let's see if there are resources. All
Right.
right. All right. So the first thing I'm going to say is a bit of advice that my therapist gave me.
Mm.
We are all children wrapped in layers. Every single adult is a child wrapped in layers. And so what that means is that our life view was crafted from childhood. Now, would you pay attention to a 3 or 5-year-old if they told you, the way the world is with the pink dragons that I would have seen? Or would you really pay attention to a toddler telling you how life is? No. And yet, that's how, as people, we learn how safe our environments are. And if we're in a dangerous environment with parents, we learn the world and the universe is not safe. Fast forward X number of decades, you're an adult, you're having a PTSD flashback issue, flare. Somebody telling you, just walk it off, it's all going to be better, does not address that 3 to 5-year-old who learned that this is the way that life is. So that person who's saying, walk it off, you live in the past, does not have an understanding of trauma, which makes sense. I'm Generation X. My parents had zero understanding of trauma. I had zero understanding of trauma until my late 40s, until it kind of smacked me in the face. So I don't disregard or get on people for having that kind of advice. I would say once they have an understanding of trauma, their advice changes. Secondly, if you are working, if you do have a friend who's in this like PTSD spiral, they're freaking out, they're listening here, they're listening in their heart to your nervous system. And the best kind of friend you can be is an empathetic witness. Don't try to talk them out. Would you be able to logically talk to a toddler and have them go, oh, yeah, that totally makes sense? No, you need to remember that when we're talking about trauma, usually it's from childhood, unless it's like something very recent we're dealing with, like a car accident or something of that sort. But like PTSD from child abuse and child neglect, it's deeply embedded. And your nervous system being a calm presence while that person is expressing and talking will go way further than trying to solve the problem, because they're here, they're not here. and for the people who are listening, I'm sorry, they're in their heart, they're in their emotions, they're not in their thoughts, and they're not in their head. This is not an intellectual. PTSD is not necessarily, in my opinion, an intellectual thing. It's a purely emotional. You're being told by your childhood self something's not safe, something's not good. So, like, I guess maybe one of the reasons why I do talk about psychedelics for health, specifically MDMA for PTSD, is that everything you've just said about how people might be like, just take a walk, it'll be fine tomorrow, you're living in the past, grow up. It doesn't work. I needed a psychedelic to calm my body down, stop me from being afraid, because my toddler view of my 230-pound, 6'2" father beating me, I couldn't understand that my caretaker wasn't taking care of me. I understood the universe was against me and I wasn't good enough to be loved. Because that's what we do as children. So, yeah, if that's what you're feeling as a late 40 something woman, I'm not good enough, the universe is out to get me, everything is scary, someone telling me, you know what, you're just living in the past, that does not work. If it worked, we wouldn't have 10 to 20 veterans a day committing suicide.
Yeah. So, you mentioned your career, and most people who experience childhood trauma unresolved often make the statement, well, I turned out fine. Look, I'm successful.
Have you seen
So,
me? Right.
have you seen me? I've
Yeah.
accomplished this and that. What would your message for the said population be?
Well, that's actually one of the reasons why I speak out, because when I started looking at this therapy, thank goodness there was clinical research, because I wouldn't have done it if there wasn't clinical research. And all that research is at maps.org, maps.org.
Napster.
They are, and I'll send that to you for the show
Thank
notes.
you.
It's a mouthful. It's the Multidisciplinary Association for Psychedelic Studies. Say that 5 times fast. So while there was clinical research, they were at the second trial when I was looking at my therapy. There were not anecdotal reports. And my stereotypes of people who take psychedelics, rainbow hair,
Mhm.
lots of piercings, my stereotypes,
Yep.
because I was not in drug culture.
Right.
One of the reasons why I speak out now is that I was a corporate girly. Me at the time, I would not have listened to someone with 5,000 piercings, and because my stereotype would be like, that person's making crazy decisions. I'm not going to listen to that person. I needed another corporate girl. And to be honest, a female. I don't know if I would have paid attention to a man. I needed to kind of see someone who had kind of my trajectory. And that's one of the reasons why I speak out. I post almost every day on LinkedIn, because I guarantee there's a lot of high achievers like I am who are actually high achieving due to a deep fear of a deep fear of lack of safety. It's one thing to be super motivated. It's another thing to have your motivation to succeed as a symptom of your trauma.
Absolutely. Absolutely. People don't usually draw that correlation. High achievement is actually trauma response.
It can be,
Yeah, it
absolutely.
can be. It can be. Not always, please,
Not always.
people. Not always, but it
Yeah.
can be. Coming from my culture specifically, we believe in education. We believe in, achieving this, achieving that. So it's a running joke that in the Nigerian culture, when you're born, you're predestined to either be a lawyer, a doctor. You're handed your career at
Oh,
birth. Right.
immediately.
And immediately, and that can usually cause stress, but we cannot complain about it. We can't talk about it. You just have to achieve. And many of us achieve a lot. Many of us are high achievers. We've
Yeah.
done well for ourselves and our families, because you have to promote your family name. But a lot of us do suffer, but we suffer in silence. We do suffer in silence. So let's talk about MDMA.
Okay.
I am very interested because you touched on the question that I was going to ask you.
Oh,
When we talk about psychedelics, what comes to mind is Woodstock, right?
right.
That's, the rainbow children of
No
the
hair, lots of piercing, little cookie. Absolutely.
right? Bell bottoms, Jimi Hendrix, rest well.
Yep.
So psychedelics in healthcare, how is that helpful?
Well, so to let your listeners get a big picture of this,
Right.
our Food and Drug Association, FDA, Association, Administration, Agency,
Administration.
whatever they are. Yeah, you'll know better than I will. They have designated the psychedelics, MDMA, LSD, and psilocybin, which is magic mushrooms,
Mm.
all as breakthrough therapies. And the breakthrough therapy designation or the breakthrough designation means that that particular outcome from that first clinical trial is better than anything on the market. And that designation is supposed to fast track drug production. So this is no longer fringe. There's a full underground of folks, but this is no longer just fringe. This is multi-million dollar companies, like 200, $300 million companies doing clinical trials, psilocybin for depression, anxiety, end of life anxiety, LSD treatment resistant depression, MDMA, PTSD. So the big picture is that these compounds are being studied to help with mental illnesses. I like to say mental injuries. And the primary way, I am not a doctor, so I'm going to do a like less than level 100 on this.
That's what we need.
The primary way that psychedelics work is they, especially MDMA, but some other ones too, they will flood your system with like a serotonin or a dopamine. And they might, like MDMA in particular, they might actually dull the amygdala, which is the fire alarm of our brain.
Mm-hmm.
And so serotonin is the make you feel good, dopamine feel good. There's a couple of other chemicals with some of the other ones. But what essentially happens is that it shuts down. There's something called a default mode network. When you're driving your car and you're kind of zoning out and you just have that running voice, psychedelic interventions they quiet that voice, and other parts of your brain that don't really talk to each other can start to have some really interesting connections. There's a beautiful graphic of like a brain that is not using a psychedelic, and there's like 3 or 4 connections across. And as soon as the person goes into was it an MRI or brain scan machine, whatever it is, can you tell I'm not medical? All of these connections are being made. And so in MDMA's case, a huge surge of serotonin, decrease in the blood supply to the amygdala, so calm down that fire alarm. And what that did was it calmed my body. I'm putting my hands on my shoulders because I think like my shoulders were up to my neck my entire life. It calmed my body down. The serotonin made me trust my doctors. By the way, it was my therapist and my guide, a male and a female. I was more empathetic. I was ready to be much more chatty. And for the first time in my life, I was able to explain to 2 people that I was 100% sure that if my father was in the room, he was going to kill me.
Mm.
That's not something I could have ever come close to in real life because my body would have been flipping out. And so, super long answer, these compounds are being investigated for how they calm certain parts of our brains, how they increase neuroreceptors for other neuroreceptors, the 5-HTPA receptor. We don't have to get into that because trust me, I'm not the person for that. But what all of that does is allows us to look at past situations from our adult perspective versus from when we were a child. And that reframe of that 230-pound, 6'2" man, he was the abuser. The universe is not against me. There's nothing to be as scared of. And I'm certainly good enough to be loved. He was the problem. What would we say if we saw a person outside beating up a toddler? We'd be like, he's a real jerk. We need to go intervene, right? That's actually literally the healing, almost memory by memory by memory, reframing it and realizing that we've been living under this view of life crafted from when we were abused children.
Wow.
I know, I give you long answers. I'm so sorry.
No, don't be. I love long answers because the long answers answer my questions, right?
Okay.
So the next question that I really want to ask, since the FDA is involved, how will MDMA be marketed? Will it be marketed, through the pharmaceuticals? Would it be something that is considered an alternate therapy? Because with alternate therapies, more and more traditional practices are being incorporated into medicine now, like acupuncture. Would it be something that the doctors can provide, or are we going to go the dispensary routes like
Right.
now? Right.
Yeah.
So when this becomes approved, FDA approved, how would it be marketed? How would it be sold? How would the general public get access to it?
Yeah. So that's a really important question. And it's interesting you say that because the FDA advisory committee, some people were completely not knowledgeable about how this process worked, and it caused unnecessary fear. So here's the thing: psychedelic assisted psychotherapy, or using psychedelics for any sort of mental injury. Remember, I like that term.
Mhm.
This is not something where you're going to be able to get a prescription, go to CVS and get your MDMA and go home. This is an intervention the same way that you would have surgery as an intervention.
Okay.
So I like to use that model. If you're having any sort of surgery that's a medical procedure, the time before the surgery, let's consider that 40% of the overall time. 40% is preparing. For me, maybe I had to lose some weight. I definitely had to kind of like do some, you got to prepare all that kind of stuff for that day, right? You might have to change your diet, da, 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 da.
Mhm.
The actual procedure day, or like the surgery day, or the psychedelic day, that's 20%. That's a full day. It's 5 to 8 hours with 2 people in the room with you, ideally. That's actually the MAPS protocol. And there's a good value to having 2 people in there. It should be voice recorded. Video's too long because it's, so long, but it should be voice recorded because you say things in your subconscious that you don't even realize. Like going through the transcript was beautiful. And then the last 40% is your home. And by the way, you've gone to a place, a beautiful journey space that's nice and safe. You've gone to that place for that 20%, for that 5 to 8 hours. And then you go home. And the same way that you have physical therapy after a medical procedure is the same way you should be having some talk therapy or working with a coach. It's called integration in the psychedelic circles because as you're reframing your childhood memories, you're integrating your new point of view into your life. And suddenly you start to see things very differently. And so preparation 40, psychedelic day 20, integration 40. And so the medical model should have some sort, if, I don't know how it's going to look if you're, because I've been in such a long-term therapy environment, but you should have some sort of therapeutic relationship with the people with whom you're going to be working. So that's the 40% prep, the actual day where you go to a place. That's why people are like panicked about addiction and things of that sort. You're not given like 30 MDMA pills. You're given a therapeutic dose in a setting. And then you have your
Right.
integration, your physical therapy, your talk therapy. I think once I kind of explain it as the medical procedure it makes a lot more sense to people.
It does. It absolutely does. So it's the point of care treatment. So you go and get a
Oh,
treatment. Yes.
yes. Oh, that's a beautiful point of, see,
Or-
I'm writing that down. It is. Yes.
It is a point of care treatment where you're given the therapy, whatever discussion needs to happen in that environment. You're stabilized. You go home. You follow up, just like a surgery. You finish your surgery. You're stabilized. We know that you can pass gas. You can pee. Great. So we send you home. So you
Got it.
follow up with the doctor after the surgery. You mentioned physical therapy. If it was a knee replacement, we then, schedule your physical therapy and you continue to build off the treatment that you received at the point of care. So I think that is a great idea. That is absolutely beautiful that a structured treatment of that nature is being planned for this.
Yeah.
So for the longer term folk, right? Because we do know that depression can be episodal.
Mhm.
We do know that with PTSD, people do have crises. Things do happen.
Sure.
So, what would be the long-term plan for folks who fall within this category? Would it be like a planned point of care every so often, like a steady frequency, or would
Until
it be
the
just to be
diagnosis.
blessed? Okay.
Uh, that's a beautiful question. I can totally tell you're in the medical field. Uh, so I needed to go through 3 cycles over the
Mm,
course of a year, that 40-20-40.
right.
I needed 3 of those.
Okay.
My first journey, and I'm using the word journey with psychedelics therapeutically, journey, psychedelics recreational trip.
Right.
So my first journey was September. My second journey was December. My third journey wasn't until May
Mm,
because my doctor and my therapist pretty much let me set the pace. The clinical trials are more structured. They're like, I think it was like once every 6 weeks or a month or something like that. You have to give, with MDMA, you have to give time for your serotonin to kind of come back to stable levels. Mine was much more, they just let me kind of follow my own pace, but that's pretty much the clinical evidence right now is on average 3 sessions to get about 3/4 of the people to no longer have a PTSD diagnosis.
okay.
And let me be super candid and transparent.
Right.
After that year, I was no longer suicidal. I wasn't hypervigilant. I knew I had a future. And I also knew I still had a boatload of trauma to heal because I was marinated in abuse and trauma for, 18 years.
Mm,
So at that point, I had continued. I decided to do, I think over the course of the following year, I did 2 more psilocybin journeys with my doctor and guide to just kind of start to understand the origins of that fear a little bit more. But in no way, shape, or form were those crisis situations the way that the MDMA PTSD stuff was. And then since then, like the same way you go to the gym and you keep getting healthier and you keep kind of working on yourself,
right.
I've used psychedelic tourism to just continue to chip away at, the trauma. And once you start using psychedelics to understand your mind, I wouldn't say hobby because you do it like every 6 months or something, but it's a really interesting activity. If you're curious about yourself and your mind, psychedelics, and that's what's happened with me. I've tried a variety of different medicines to understand how they work with trauma, because people come to me all the time with questions, and I didn't only want to understand MDMA.
Right. It almost sounds like self-care. It almost sounds like, self-care. Every
It
6 months,
is.
you get it done for yourself to understand yourself more, understand this journey called life, and understanding what you overlooked. Because we'll be surprised of how much we overlook in life, to survive, right? When we talk about access, what are the criterias that we're using to determine who can participate, say, in the clinical trial, or who can actually benefit from this therapy? Is there like a benchmark of, say, diagnosis or need? What are the parameters of determining who's eligible?
Yeah, you know what? Go to I'll send you this link because I always mess this up. I need to memorize this link. It's like Gov Trials or it's like clinicaltrials.gov, one of those. And it's the repository of where people post their clinical trials.
Okay.
And you do have to use the filters, but you can find recruiting. You can actually search by psychedelics and you can find recruiting. The other thing to do is set up a Google alert
Okay.
to because a lot of times what companies like Compass Pathways, for instance, is a company doing research, and I just pick them out of the hat. Like, don't go to their website expecting that there's something there. I just pick them out of the hat. They will very often post a website saying, "Hey, we're looking for folks." Sometimes they'll post on LinkedIn, but usually it's on their websites. It kind of becomes a word of mouth. So if you set a Google alert for like a couple of keywords that you're really interested in, you might be able to find them too. In my experience so far, because the clinical trial criteria, because of how they have to test it, the trials kind of have some very clear specifics.
Okay.
So yeah, you have to start looking at the trials. And that MAPS website is a great one they're always running different trials on different diagnoses. Johns Hopkins is always doing stuff with psilocybin. Like once you start doing, UC Berkeley is probably another good resource. Once you start doing some internet searches, you'll start finding those places. I'm sorry I can't give you a better answer, but
No. You gave me plenty. There's plenty, because this podcast is not just to have a discussion. It's also to be a place of resources for people, because people always have questions, but they don't know where to get answers. So with all my guests, that's why I talk to subject matter experts, right? People who either have had a lived experience or a work experience in a certain area, because just like you exist, there's somebody else that exists that is seeking help, right? So thank you. You provided a lot of information. I have to do my own homework to make sure that I have, quite a few resources for whoever needs it. So my I don't want to call it the last question, but one of the questions that I had in mind when you were talking about, marinating in trauma for 18 years, which is a long time, right? So, to your knowledge, are we also studying and trying pediatric people, or, I don't want to call them patients because they're actually not patients.
clients.
Are we clients, population, right? Because if there's no need to marinate in that trauma for 18 years, why not be proactive about it if trauma is at least recognized for those that are recognizable? Do you know if this population is also being studied or at least tried?
Yeah,
No?
it's really interesting because I had two podcasters who turned out to be in high school. And I refused to do the podcast. I'm like, look, I'm talking about Schedule 1 drugs right now, and we're not going to have that conversation with adolescents.
Right.
I thought it was really cute. And they were like, are you sure? I'm like, yes, I'm sure. Trust me. Here's the thing. Getting treatment for me, because my trauma was my parents, getting treatment when I was a child would not have been helpful because I was just being thrown right back into that situation.
Okay.
What I'm curious about two things. And yes, I do look through life as a female, so this is going to be female centric. For women who are victims of sexual assault or some sort of, physical abuse when they're teenagers, could this be an intervention, especially MDMA, which is, nice and gentle? I don't know. Our brains aren't really fully developed until we're 25. I think we have to do some very, very careful research
Right.
because the last thing you'd want to do is kind of embed that trauma. My hope in 10 years, we'll have an answer that a psychedelic can or can't be a good intervention for a young person who has experienced a horrific thing.
Right.
Or maybe they have to wait till they're 25. It'll be really interesting to see where the research is. I haven't seen anything specific. I've seen anecdotal with parents with folks who are autistic or ADHD, kind of doing it on their own with their child. I haven't seen any clinical research yet. It'll be fascinating to see what can be done, because if you can live years, oh my gosh, if this therapy had been available when I was in my 20s, I would have been the first one signing up.
I can imagine. And I'm also interested to see the data or the study on the pediatric population or the young adult population, because the beautiful thing about the pediatric brain is that it's very fluid and elastic. And if there's any intervention to be done, especially with something that is episodal in nature, the treatment is very episodal and is at a point of care, and your body is given time to, rebalance itself. The body is at a place of really cementing a lot of things during the adolescence and young adult life. And I think it would be beneficial for the mind, the body, the spirit, the soul, not to cement trauma. So that shift, right? To learn that healing and not cement that trauma. And at a point where it gets to the age of 25, where a lot of that cementation happen, or that concreteness of thought and feelings and emotion and drive happens. It is happening on a clean slate, a solid foundation. I think it would be helpful. And again, like in medicine, we titrate everything, right? We titrate doses of everything. Titrating basically means to adjust the dose,
Oh,
right? So I wouldn't give the same dose of insulin that I would give to an adult to a child. Why? Because
right,
in
right, right,
order
right.
to dose a
Dosage
child,
matters.
absolutely, I have to take into account the weight and the height of that child, right?
Yeah.
Specifically the weight of that child per kg, per dose, per kg, per whatever, right? I have to take into account a lot of things. And in medicine, more and more we're really moving, not moving, but also including the holistic side of of
Mhm,
things.
mhm.
There's a saying that nurses are trained to care for a person and doctors are trained to focus on the disease. It's not wrong. It is, it's why you have nurses at your bedside, right?
Yeah.
But more and more, we're taking into account that the social aspect of a person, cultural needs, then social determinants of health. That is something that in the last I would say 7 to 8 years has gained a lot of traction in healthcare, because the person that presents to the hospital, to the clinic, right, still has their life outside of that presentation. So if
Sure.
I prescribe a medication, if you cannot afford it, you're going to come back worse to your next appointment. So how about I connect you with social services, with whoever, to try to meet that need? I think it will be beneficial because, like you said, you didn't even recognize this was trauma growing up. You normalize this as much as you could for survival, right? But the children that are actively in foster care
Right.
that we know have been traumatized, right?
Yeah, I'm on board with it. I mean, even just the idea of a low dose, I
Right.
think there's just a concern with not understanding
The
how
long-term
the
effects.
serotonin system works
Okay.
necessarily with adolescents. I would be shocked if in 10 years we don't have some research on it, though. I mean, yeah, there's no reason. I mean, think even if at 18,
Mm,
somebody coming out of the foster system says, I'm ready to start,
right.
we'll have more information.
Right. Because they do age out at the age of 18, which is unbelievable. At 18, what do you know?
I
No,
knew nothing.
seriously. At 18, what do you know? You're just kicked out. Oh, you're on your own now. Go ahead, be blessed. But
without
I know.
without a really strong emotional foundation.
Thank you. But,
Yeah.
I feel there would be a lot of benefit to the young adults and adolescents that have experienced trauma. It would really help because unfortunately, when they're left vulnerable, what do they turn to? More trauma and more self-destructive behaviors, right? In an effort to heal.
So for any of the young people out there who are hearing us talk about this, and you're like, I'm gonna try this, you do not try this off of something you bought from the street that you haven't tested. And you do not try this alone. You need to be in some sort of therapeutic relationship with somebody there to support you. If MDMA worked for trauma by itself, then every single raver would not have trauma.
That's
There's two components to this. One is the medicine, and the other side is the human support that you
right.
get. I just wanted to put that disclaimer out there for anybody who's like, oh, wow, let me do this.
Please do not misconstrue whatever we're talking about. We're talking about treatment,
Yes,
fun stuff, right?
yes. That
Nobody,
hasn't been researched yet.
yes, please. It hasn't been researched. We're just talking about possibilities,
Yes.
right? The possibilities of clinical treatment utilizing FDA approved. The guy at the party is not FDA approved. I can tell you that.
He
Please.
is not. Get your testing strips, people.
Please.
Yes.
It has to be somebody with a license behind their name in a control setting, i.e., a hospital, clinic, wherever. Okay. It
We're
is
a few
not,
years away from
we're
it.
years away, light years away.
No, just a few, not light years, just a few. But yeah, don't
For the
be
kids.
very careful if you're because people are going underground, and I'm actually going to be developing some content to help people kind of navigate that. But the most important thing, test your substances and do not do this by yourself.
So I have a question, Jill, right?
Yeah.
With the people going underground, right? I know sometimes it's out of desperation or being like, this is like your last bet or your last ditch effort, right?
Sure. That's
What
what it
are
was
the
for
safe
me.
ways to go about that? You say you're going to create content. I can't wait for those contents to be presented. But if somebody was to listen to this, if I publish this by next week, somebody was to listen to this and they're like, okay, even if the criteria is not met, understand it, but I do really want this therapy. I really do want to look into it for myself. What are the safest ways to go about it without having to fall into the wrong hands?
If you are suffering from depression, ketamine therapy is legal in the US. And so that's one of the first things. And I think even some insurance companies cover it. So that's the first thing to investigate if you have a depression diagnosis of any sort.
Okay.
If you're looking at other diagnoses, if you're looking at anxiety, if you're looking at addiction, if you're living with PTSD, but you're not at a crisis mode, if you're at a crisis mode, get to a doctor now, do whatever the doctor tells you to do. Okay. So we're talking people who are not in crisis right now, but know that they have a diagnosis.
Mm-hmm.
The first thing to do, believe it or not, the same way that you have an interest in anything else, what would you do? You would search out some groups. Social media is amazing with the different groups that are out there. There's even a local King of Prussia psychedelic group that I belong to. There's groups everywhere. And you really want to start networking. You want to start understanding the medicines. You want to start doing some research. You do not want to find out that magic mushrooms are great for addiction and next week take a bunch of mushrooms. What you want to do is you want to research it. You want to understand the process, how it works. You want to start connecting with people who have maybe done it and can recommend people to work with. It's not going to be free. The same way that you would vet a doctor. What's your expertise? How long have you been doing this? Do not go to the 22-year-old kid who has just had 3 mushroom journeys and thinks that he or she can save the world. You would vet a doctor by the degree and the experience. You can do the same thing with people working underground. If you get an icky feeling, you move to somebody else. If you've got pretty impressed, then consider working with these folks. There is risk. This is illegal stuff, and this is your mental health.
Right.
So treat it with the importance that both of those ideas bring to the table.
I love it. Thank you. That was beautiful. So for everybody listening, I hope you all got something from it because I know I did. It's so amazing that every day in medicine, in life, we're discovering things to, help us out because you know what, in every day we're changing. We are no longer living in caves, right? We've decided
We're
driving
not
and
that lucky.
we decided driving and commuting and living in tall buildings is the way to go. But I mean, what can I say? We want to be birds. So, I'm hoping everybody listening, learn something. Jill, I'm hoping you and I again can talk and talk more about this. Please engage, comments, let us know what you think. With the resources Jill has provided, I'll make sure I continue my homework to include them in the show notes. And also, I will be reflecting these resources on the Altruistic Scribe site. It is my life goal to build resources for people. But please, 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 Jill does this. This is her corner. She's an expert. I'm learning from her as well. I'm still learning. I'll continue to learn like she's given me homework to do. I took lots of notes.
Sorry.
Lots and lots of notes. So be careful who you get stuff from, okay? This is a trial. It is not FDA approved. Like she said, there's still one more clinical trial
Yep.
pending.
Probably.
Yes. Probably one, but we never know. But it is something that is useful. She has given her personal story, how this has been effective for her. So this was great. Thank you, Jill. I really, really thank you for being here and having this
Absolutely.
conversation.
This was delightful. Thank you for letting me have this chat. Really appreciate it.
Thank you, Jill. All right. Thank you, everybody, for listening. Take care of yourselves. Bye-bye.
Thanks for tuning in to Unshelling Medicine Podcast. If you want to stay up to date with the latest episodes, make sure to hit that subscribe button on your favorite podcast platform. If you enjoyed today's episode, please take a moment to leave us a review. Follow us on social media at Altruistic Scribe on Instagram, TikTok, Facebook, YouTube, and LinkedIn. We share additional tips, updates, and health-related content that you won't want to miss. Have any questions or topics you'd like us to cover in future episodes? Reach out to us at altruisticscribeco.com. We're always eager to hear from our listeners and tackle the health topics that matter most to you. Until next time, stay healthy and take care.